everybody, welcome back. I'm Dan Haggerty. This is In Depth, where we spend a little bit of extra time to speak frankly about complex and sometimes difficult topics. I say we because you at home are a big part of this segment. I want to hear your thoughts and your ideas. You can ask questions, be critical about the way we report certain topics. You have a voice here. Just email me at dan@WRAL.com or find me on social media, the Facebook, Instagram, Twitter, that sort of thing. Just search Dan Haggerty. Now, last night we started our week-long series on youth mental health. I'd spent about an hour or so with 10 people here at WRAL, kids, parents, doctors, advocates, to talk about this crisis and the latest tragedy that's devastated our community. When an 8th grader in Wendell, the boy on your screen, Austin Pendergrass, died by suicide at his school. His family described him as an amazing little boy. And it's how we started our conversation with the group. When you saw the news last week of that 13-year-old boy, what did you think?
That could have been my child. My child's had those feelings before. She has those feelings still.
Tiffany's child is Arianna and has been a powerful voice in the conversation around kids and mental health.
I think just adults just listen.
In 7th grade, she spoke to our documentary unit for Pandemic Generation, an alarming look at the struggles our young people are experiencing and the lack of help they're getting.
I worry that we're going to all be socially awkward and we aren't really going to know who we are or where we fit in, and that might lead to a whole new road of mental health issues for the future.
Arianna is in 8th grade now, and I was anxious to check in.
I'm wondering, it's been a few months. How are you?
It is still very difficult for people to be able to get help. I currently have been on a 2-month waiting list and still have 2 months left to go, at least, in order to be able to see a therapist.
I've been just seeking out different therapists between moms groups and trying to get suggestions, insurance, and it's like you think you have somebody and then you narrow it down by insurance and it's like they're not accepting new patients. I've made phone calls, they're not accepting children, they're not accepting teens.
Do you also have this feeling that, are you not looking in the right place? Is there some path you're not walking down? Do you ever feel that way?
Absolutely, and it just feels like there's closed doors everywhere. And I resort back to the moms groups, and it's daily that there are posts of people from all the way to 6, 7 years old, parents of 6, 7-year-olds, all the way up to teens that are, who can I take my child to for help? They need to talk to somebody, and there's all these suggestions, but it's just a lot of closed doors.
Experts believe a community should have between 40 and 60 mental health beds for inpatient care per 100,000 people, according to studies as recent as 2021. Right now, Wake County has about half that, just 26. That shortage ripples into backlogs that affect the entire industry. And it was the perfect topic for a woman in the back row of our group, Wake Med's Chief Medical Officer for Mental Health.
So we don't have help?
There is help out there, but it's not at the scale that people need.
How urgent is it for us to scale up?
It's incredibly urgent. I mean, every day that there are people dying from mental illness. We don't always think about mental illness being a deadly disease and a deadly series of diseases, but it very much is.
Why has it been such a struggle then to ramp up as quickly as we need to?
Part of it is that there's no easy solution. When you think about all the different needs and coming at it from different angles, there isn't a very clear one-size-fits-all.
Now, in healthcare in general, few things are one size fits all. But with, let's say, cancer, there is a protocol there that can be rather general. The causes, the symptoms, the treatments, they can be similar for most patients, but that's not the case with things like bipolar disorder or anxiety. We're going to explore that a bit more tomorrow. Now, I know this report is a bit bleak, but that's the reality that we are facing. It is important, though, that people, everybody, all of you know that you are not alone if you are feeling a certain way. We are in this together. Angel, for instance, emailed me last night and said, hey, Dan, could you please provide more information where we could find some of the resources available? Angel, absolutely. I'm glad you said that. And there are plenty of great places for people to start. So each night, I want to end these segments with ways to help. We, for instance, have a great collection of resources right now on WRAL.com. It's titled Get Help, County by County Guide to Mental Health and Crisis Resources in North Carolina. Just get on the website, look up Get Help. It'll take you to that area of the website. And look, these are not perfect solutions. I'll tell you that right now. But these numbers, these organizations are a great place for people to start. I know a lot of folks think that they're alone in the way that they feel. But I assure you, you are not. And if you take that first step, if you reach out, you'll see exactly what I mean. I'll be spending a little time each night talking about solutions and resources. I also want to have a conversation about what people at home think is contributing to this uptick we have seen. What are your opinions on that? Let me know what you have to say. Email me at dan@wral.com.